Good afternoon, class, and good afternoon, professor. I'm here to speak more into my career, my future career as a physician's assistant. So over the course of the semester, I was able to work on my healthcare career paper and get a lot more information that I hadn't known before for the PA career. So this paper really helped me understand it. I learned the code of ethics that physician's assistant must have, which is to respect patients' beliefs, values, culture, and expectations. As far as any medical professional should be doing, and that's something that physician's assistant, their main importance is that physician's assistants nowadays, with how everything is going, there's not a lot of MDs present, so they're usually the first person and sometimes even the last person that you see before leaving any medical facility. So when you go to an urgent care, when you go to a hospital, when you go to an emergency room, even sometimes when you go to your doctor's office, the first person you'll see is a physician's assistant. So as a physician's assistant, it's our job to fully greet the patient, work with them directly as far as treatment, treat them with the respect right before they see an MD, and we figure out what the situation is with their health. Physician's assistants always, as being the first person that they see, they should develop that relationship already with the patient way before the MD comes in. Me wanting to specialize in oncology, after my certification and after doing my 2,000 rotation hours that are required by the Physician's Assistant Board to be an oncology specialist. And I've learned through my career as a infusion technician at Miami Cancer Institute that the oncology physician's assistant is mainly the person who works and does the treatment plan for each patient. So my healthcare career paper developed, I was able to jot down more information as far as oncology and when I do want to go into it, which is right after I finish school, and hopefully go further in that, maybe even, who knows, develop a cure and finally find something that can help these oncology patients as far as their treatment plan. But I did learn that physician's assistants work directly with the head oncology staff. Each individual patient has an individual treatment plan. And, like I said, PAs are your first, and sometimes in this case, for oncology patients, the last person that you see. So it's always best that you, as a physician's assistant, you make their visit as pleasant as possible and as adaptable as possible for them during this hard time. I did learn that, as an oncology physician's assistant, you're in charge of a lot of work. Not a lot of work as in the sense as in paperwork and stuff like that. That too. But I did learn that, your a lot of work is you're dealing with the patient's emotions. You're dealing with the patient's, you're their direct line of communication when it comes to their survival, even as far as oncology patients are concerned. So as a physician's assistant, that code of ethics that we do value, respecting patients, everyone has an opinion and has everything. And there's always a way for you to speak to a patient, as well as even helping them understand what's going on. Try to have, make them have a better understanding and a better way for them to, to live on and to continue living while you're working on their treatment plan. So I do want to thank you, Professor, for introducing us to this healthcare career paper subject. I was able to learn a lot about my career, and I was able to learn a lot about myself, and as far as, my personality and how it fits well with the physician's assistant program. And I was able to learn things that I had no idea as far as physician's assistant. So many laws and so many things that they can do that you don't need an MD present. You as a physician's assistant, you have that responsibility. You have that honor to do everything and work hand in hand with the patient. So I do thank you very much for introducing this topic to us, and it's been a pleasure to have you this semester, and it's also been a pleasure to learn more about my future career. Hopefully one day I can take care of you or your loved ones. So thank you so much.